It's an honor to have Dr. Brucker with us today and to be part of the weekly research seminar hosted by Shirley Ryan Ability Lab. By way of context, I'm the director of the Center for Rehabilitation Outcomes Research, Shirley Ryan Ability Lab. The hospital is a recipient of a Rehabilitation Research and Training Center Award on Employment for People with Physical Disabilities. We're now in the third year of that project. By way of background, there are 4 research projects focused on a telehealth intervention for chronic back pain of people who are employed, a couple of surveys of employers and vocational rehabilitation clients regarding job accommodations, a specific project on Parkinson's disease and employment, as well as stigma management in the job accommodation process. In addition to those 4 research projects, we've got a robust knowledge translation set of projects that Dr. Linda Ehrlich-Jones oversees, including webinars. So with no further ado, Linda, would you like to introduce our speaker?
Thanks, Alan. It's my pleasure to introduce our 2021 Neidler Invited Lecturer, Dr. Debra Brucker. Dr. Brucker received her Bachelor of Arts in Psychology and Criminal Justice, along with her Master's of Public Administration with a concentration in Social Policy from the University of Delaware. And she received her PhD in Urban Planning and Public Policy from Rutgers University, where her dissertation studied disability, substance abuse, and public disability benefits. Dr. Brucker is a Research Associate Professor at the University of New Hampshire in the Institute on Disability. She is currently an online lecturer at Northwestern University in the School of Professional Studies. She is a co-investigator on the Neidler-funded RRTC on Disability Statistics and Demographics, and the principal investigator on a Neidler-funded project on opioid use disorder among persons with disabilities. And she has over 40 publications and 3 book chapters. As part of her lectureship, Dr. Brucker will be available for consultation this week on employment and disability and food insecurity, 2 of her areas of expertise. If you're interested, please contact me at ljones1@sralab.org for further information. Dr. Brucker's presentation today will include an overview of current labor force and employment statistics for persons with disabilities in the U.S., and she'll present findings from a recent study that examines job quality among workers with disabilities. She will conclude her talk by discussing preliminary results from a study that she's testing the effectiveness of an intervention designed to support workers with physical and mild cognitive disabilities in recrafting certain aspects of their jobs. Please welcome Dr. Debra Brucker, our 2021 Neidler Invited Lecturer.
Thank you, Jose, Alan, and Linda for inviting me to this lecture. I'm glad to be here, and thank you everyone for joining us. I will share my screen and then we can get started. So as Linda mentioned, I have broken this talk into 3 related but separate sections. My area of interest is in employment among persons with disabilities. And my research spans data and statistics related to that, as well as looking at issues of job quality for persons with disabilities, and then also testing an intervention that aims to help people with disabilities remain employed and be successful in their jobs. I'd like to acknowledge funding for this research was provided by Neidler through our Rehabilitation Research and Training Center on Employment Policy and Measurement grant that I'm the PI of, along with Andrew Houghtonville, as well as Neidler funding we received from to do our career self-management through job crafting project. I'm co-PI of that project with Vijay Sundar. So I'd like to thank both Vijay Sundar and Andrew Houghtonville, as well as a host of other people at UNH, including Abby Baker, Megan Henley, Kristen King, and the Kessler Foundation for collaborating on some of the research I'll be sharing here. So to start, I'll provide some context in terms of job numbers. So what we know about the number of people that are employed that have disabilities and how that employment has changed given the COVID pandemic. And then I'll shift to talk a little bit about job quality, what we know about the quality of jobs that persons with disabilities hold. And then I will finish by talking about the specific job crafting intervention that we're in the first phase of studying and testing. So this is a broad context of the job numbers. The US population in 2019 was 323 million people. About 13% of those people had a disability, and this included people who were measured as having a disability if they had a vision limitation, hearing limitation, ambulatory or cognitive limitations, self-care, independent living limitations. The percent employed among working age individuals in 2019, there was a huge gap, you can see, of about 40 percentage points. Around 39% of people with disabilities were employed at that time at any level, full or part-time. And this rate was 79% for people without disabilities. This also relates to what we see as big disparities in terms of poverty among people of working age. We see 26% of people with disabilities who are working age living in poverty below the official poverty line, compared to only 11% of working age individuals without disabilities. So employment obviously can help fix some of this gap in poverty that we might see between people with and without disabilities who are working age. This figure is drawn from our national trends in disability and employment that we conduct and share through a webinar every month. And it shows the labor force participation rate in February 2021, as well as the employment to population ratio in February 2021 for people with and without disabilities. And the labor force participation rate includes people who are working, as well as people who are not working but are looking for work, or who are on temporary layoff. So that's a bigger pool of persons. The employment to population ratio includes just people who were employed. So this graphic shows a comparison from February 2021 to February 2020, showing that there wasn't a huge amount of change in the labor force participation rate at that time for people with disabilities. And there was a slight drop for people without disabilities from 2020 to 2021. If you look at the bottom portion, you can see the employment to population ratio. There was a slight decrease for people with disabilities from 2020 to 2021, and an increase as well for people without disabilities. I have a different way of showing you the impact and how things changed and have recovered a bit during the pandemic. So this slide shows the employment to population ratio in March 2020, really before the pandemic was being felt and affecting the economy in most of the country. And you can see the large drop that happened in April as the pandemic took hold and started to impact the workforce for both people with and without disabilities. And there was a slight rebound in May that continued in June, July, and August, September, October. November, we start to see somewhat of a looks like a little bit of a flattening out. And this has persisted with slight decreases in January and February. So that what we saw after this huge drop in April is things have crept up a bit, but seem to be leveling off for both people with and without disabilities in terms of employment. You can see in both cases that the numbers aren't yet where they were in March 2020 prior to the pandemic. So we'll dive into these numbers a little bit deeper and explore the labor force participation rate, which, as I mentioned, includes people who are working as well as those who are not working but looking for work or on temporary layoff. And this is an important indicator to track, as it gives us a sense if there's a significant portion of people who are just leaving the labor force altogether. They may have just given up looking for jobs, or they may have applied and received disability benefits etc. So it's important that we track this as well as the employment rate. So this is our labor force participation rate in March, and I won't go through each and every month like I did with the employment rate. You can see in January and how the graph shows the changes through to January and to February. We ended up with 76% of people without disabilities in the labor force, and this is in comparison to 76.9 that was in March 2020, and 33% of people with disabilities were in the labor force compared to 34.9% in March 2020. So this slide, this chart, includes all of the months that I just reviewed in those other graphs, but a different way. So we like to play around with our numbers. But it also shows the not in labor force percentage for people with and without disabilities, which, as I mentioned, is an important thing to track. You can note in April 2020, that was where we saw the biggest drop in employment for both groups. And you can see the increases in unemployment, as well as the percent not in the labor force. In January 2020, at the end, I think if I highlight that, you can see there was a slight increase in the percent not in the labor force for people with disabilities compared to February 2020 at the top of the chart, as well as significantly higher for people without disabilities at that point compared to prior to the pandemic. We also were interested in breaking down oh, we're missing a slide there. All right. So we also looked at more detail around unemployment. Slide here. Trying to look at the differences, as I mentioned, between temporary layoff and looking for work. And that's what this slide is showing. I apologize. I have to move my controls of the Zoom call. But you can see that temporary layoffs remain significantly higher for both groups compared to where they were in March. For people, looking for work they're significantly different than they were in March for both groups. So people are still searching for work. These are people that are not working at the moment, and the percent that are looking for work remains high. So we can see some of the impacts of the pandemic on the employment of people with disabilities. And we're not, we need to continue to monitor this and see how the economy recovers and if people with disabilities are able to regain the ground that they had prior to the pandemic. Another area of interest of mine in particular is seeing whether people with disabilities, flee certain industries or occupations that perhaps, were more likely to lay them off or had more of a public facing type of position that put them perhaps at higher risk of obtaining COVID. So those are the types of things we'd like to track going forward. So now that we know a little bit about the employment situation as a whole in the US, what do we know about the quality of the jobs that are held by the approximately 4 million workers with disabilities in the US? On the international stage, this is an area that has gained prominence. These multidimensional measures of job quality are becoming more important as additional indicators that you can look at to measure the strength of economic activity for the general population. So there are different ways that this can be measured with this multidimensional fashion. The European Job Quality Index, for example, includes measures of pay, the intrinsic quality of work, employment quality, health and safety, work-life balance. So it's not just about whether you have a job or what you're getting paid, but it's all of these other factors as well. The UN Economic Commission for Europe incorporates even more factors, including safety and ethics, income and benefits, working time and work-life balance, security of employment and social protection, social dialogue, skills development and training, relations and work motivation. And then there's an MPA declaration that speaks to the importance of a living wage, labor market security, and quality of the working environment. So these are all international measures of job quality. In the US, some researchers have looked at this in general, not specifically for persons with disabilities. Horowitz, for example, looked at individual task discretion, monetary compensation, job security, low work intensity, safe work conditions. Others have looked at the ability to develop and use skills at work, as well as task discretion, work pressures, and job insecurity. And Jones and Schmidt's Good Jobs study, which I'll talk about a little bit more in a minute, looked at whether people earned a salary of $19 plus an hour, employer-sponsored health insurance, and some form of retirement plan. And people who met those criteria were considered to have a quote unquote good job. And that really informed this first study that I'd like to talk about that I conducted with Megan Henley, another researcher at our Institute on Disability. And we wanted to take that Jones and Schmidt's framework and see if workers with disabilities were less likely than other workers to hold good quality jobs in the US. So we used data from the Current Population Survey, which is a survey conducted with the Bureau of Labor Statistics and Census. We took the annual social and economic supplement from 2014 to 2016 to try to mirror Jones and Schmidt's timeframe of the data that they used, so we'd have some sort of comparison. We restricted it to persons ages 18 to 64, employed by someone other than themselves who worked for most weeks of the previous year and earned an income of at least half the minimum wage. We had an unweighted N of about 93,000 people, and we weighted everything using replicate weights, and we conducted descriptive and bivariate analyses as well as logistic regression. So as I mentioned, following Jones and Schmidt, we considered a good quality job to be one that offered health insurance benefits, paid more than median wages, which in the data we had equated to about $832 weekly for a full-time position of 40 hours or more, or about $43,000 annually, and offered a pension or retirement program. We considered a good job to be a job that included all three of these criteria: a fair job, one or two, and a bad job, none of the above. And we included a number of independent variables, including disability, obviously, as well as health status, where we categorize people as good, fair, poor versus excellent, very good, included age, educational attainment, race, sex, and urban, rural status. Our sample ended up including 3% people with a disability, 70% with excellent or very good health, about half were aged 34 to 54 years old. Educational attainment, about 2/3 had some college or more, about 80% were white, non-Hispanic, about half were female, about 87% were residing in an urban area, and only 12% were working part-time. So overall, this was among all workers. We found that 26% had a good job. 58% had a fair job where they met one or two of the criteria mentioned above: health insurance benefits, paying more than median wages, and pension retirement program. And 16% had what we termed a bad job, where their jobs had none of the above. So we next did some bivariate analyses, just comparing people with and without disabilities to see what percent had a good versus a fair or poor job. And you can see on this graph that we found that 22% of people with a disability held a good job, and 26% of people with no disability held a good job. So these rates were fairly low for both groups, in my opinion. The fair job, they were similar, around 60% for both groups. And then the bad job were 16 and 18%. That was, if we adjusted for full and part-time status, we found you're more likely to have a good job if you had a full-time position, but even still, only 29% held a good job among all the workers we looked at, meeting those three criteria. Part-time, much more or less likely to have a good job if you're working part-time, only 6%. So we move on to our multivariate analyses, which we conducted separately for full and part-time workers, thinking, there might be some level of selection, at least, that people choose a part-time job for different reasons than those measures that we were considering. They may value the flexibility or the interest in that position more than they do the three characteristics that we discussed. We did run a series of different regressions, and for a while there, it looked like disability was going to be significant until we added in health status, in which case disability was no longer a significant predictor of whether or not someone held a good job. When we control for health status, that means people who are in excellent or very good health are significantly more likely to be holding a good job than people who do not have that level of health status. We also found that education was a really strong predictor of whether or not someone held a good quality job or not. And this held true for the full-time workers, which I show here, as well as the part-time workers, which had similar findings in terms of education being extremely important, health status being important, and disability not being important. Lastly, we ran some predicted probabilities just to try to estimate, controlling for all those characteristics, what could we say is the probability of holding a good job, controlling for those independent variables I mentioned before. And we could see for full-time people who are employed, the predicted probabilities are fairly similar, about 36% for people with a disability and 39% for people without a disability. And for part-time, this was significantly smaller. So about 7% of people with a disability and 8% of those without a disability held a good job by the definition that we used here. So for this project, we had mixed findings about job quality for people with disabilities and without disabilities, controlling for health status. And my hope is that we can do some additional looking back to see how this might have changed over time or is changing in one direction or another with more recent data.
Eric, it's just super loud.
So there's a second study I wanted to highlight, which Megan Henley also assisted me with, or I assisted her. And we looked at, since education was such a strong predictor of job quality, we restricted this study to college graduates to look at whether or not they had differences in job quality by disability status. And for this study, we're looking really at the intrinsic quality of work. So not those other factors that I mentioned before, but something that was suggested by the European Job Quality Index. And so by intrinsic quality of work, this is a different subjective, obviously, measures, but it speaks to skills, self-fulfillment, autonomy, meaningfulness, social support, powerfulness, as some of the areas of work that are important to people. And this National Survey of College Graduates has information about that. We restricted the analysis to employed college graduates under age 65, so our N was around 65,000 people. 11% had a disability, and in this survey, they measured disability as having at least one of 5 possible functional limitations: concentrating, remembering, seeing, hearing, walking, and lifting. So there's some characteristics between people with and without disabilities that were similar on these two surveys in terms of the percent employed full-time, in terms of race, gender, whether or not they held a supervisory responsibility or worked in a science, technology, engineering field. And as a reminder, these are all full-time among all college graduates who are employed age 18 to 64. This slide shows where there were some differences. So our sample with disabilities were slightly older. They were less likely to hold an advanced degree. They had a lower average full-time salary or part-time salary. And a higher percent of those with disabilities were self-employed. And these were all statistically significant differences between these two groups in our sample. So this graph shows the bivariate differences we found among people with and without disabilities in these 5 different areas, these intrinsic qualities that in this survey, they measured people's satisfaction with these different areas of autonomy in terms of what they felt was their degree of independence in their job, their powerfulness, which was measured as their level of responsibility in their job, the meaningfulness, so what they thought was their contribution to society of their job, and their self-fulfillment, which was measured as the job's intellectual challenge. And then in terms of skills, the employees were asked to what extent was work at their principal job related to their highest degree. So they could say it was closely or somewhat closely agreed with that, that their job used their skills or not. And you can see that there are significant differences in every case that people with disabilities, lower proportions, agreed with each of these areas. Although overall, it seems like most were at least 3/4 or higher in both groups felt that their jobs met these criteria. So we again developed our own measure of having a good job, as we did with that last study. And we termed this as the probability of having a job meeting all 5 dimensions of intrinsic qualities of work, holding all the covariates constant. And when we did this, we did find that it was, there were differences by disability status where people with disabilities, lower proportions, 35% held a good job compared to people without disabilities, which was 43%. So our conclusion for this study is that even when people are college educated, which as I mentioned earlier, we found education important in terms of job quality, they were significantly less likely to possess jobs that used their skills in advanced training, had autonomy or independence of work, had sufficient level of responsibility, and have what they believed was an important contribution to society. So why is this? That's the general question that will lead to more research to try to figure this out. A different line of research that I'm interested in is looking at skills development among people with disabilities and how that can be fostered in the workplace, or is it fostered in the workplace at similar levels for people with and without disabilities? So hopefully we can answer some of those questions. So from part 1, the job numbers, we know that smaller proportions of people with disabilities work. And from part 2, the job quality, we can see some variation in the quality of jobs held for persons with disabilities or health conditions. Part 3, the final part, job crafting, I want to share some preliminary information about a new intervention that's designed to improve employment engagement for workers with disabilities or chronic conditions that impact work. And this work was really conceptualized by Vidya Sundar, who's an occupational therapy faculty member at the University of New Hampshire. And she and I have worked closely on this job crafting project. Job crafting is a process of redesigning and reimagining a job, and it can occur innately, so people can just do it on their own, or it can be taught, and there are a number of workbooks and trainings that have been used and studied among the general population, but not among persons with disabilities, to examine and promote job crafting. There are different ways people can craft their jobs, so they can think about task crafting or changing their particular job tasks, relational crafting and changing the nature of their interactions in the workplace, or cognitive crafting or changing their perceptions about their jobs or tasks, And as I mentioned, studies conducted among the general population have found positive associations between job crafting and some of the outcomes that we think are really important for people with disabilities to maintain their engagement in the workplace, including work performance, job satisfaction, job retention, and job growth. Job crafting, you may be thinking, if you do employment policy research, there are a lot of other types of interventions out there. How might this be different? It's very much a bottom-up approach that focuses on current employees, and employees really initiate this process and are responsible for taking charge of crafting their jobs and figuring out the goals that they want to set. It differs from some of the examples I show here in terms of customized employment or supported employment, IPS, or natural supports, or disability management programs, workers' comp. Those lists can go on and on. But it does seem to be, this is kind of a unique thing that hasn't been tested yet with people with disabilities. And we were interested in seeing, it is a generally low cost initiative as well, and could be shorter term. That might have some promise for helping people with disabilities maintain employment. So our purpose, as I mentioned, was to develop and test the effectiveness of a job crafting intervention on work-related self-efficacy and task performance and crafting behaviors for people with disabilities. And we basically enhanced the traditional workbook approach to job crafting with very brief, 1 hour or maybe 2 hours, phone or web-based coaching support and weekly online check-ins about goal attainment for a period of 5 weeks. And this was, I would say almost like a pilot study, but a little beyond a pilot study, to try to figure out, how this might work. So our preliminary research questions, how we wanted to understand, how do people with disabilities craft their jobs, and how successful are they in attaining their goals and crafting their jobs? We designed it as a mixed method concurrent design. We sampled using a convenience sample, recruiting by word of mouth, clinical recruitment companies, other sources that we could find, with a goal of recruiting 80 participants. The results I'll present here included an N of 41, but we are up to 75 people now, our latest recruitment. So we'll be wrapping that up soon and have more results to share at some point soon. Our operational definition of disability was any work limitation resulting from a chronic health condition that impacts their ability to work. We included people who were 18 to 64 years of age, able to comprehend, speak English, had a physical or mild mental psychological disability, and were working at least 10 hours a week but weren't self-employed. We excluded people who had a primary diagnosis of cognitive or psychiatric disorders, and on the understanding that cognitive limitations might have prevented informed consent for this study. So in terms of data collection, we had different phases. So pre-intervention, obviously we had to screen for eligibility, we had to get informed consent, and then we administered a pre-intervention survey that they would complete online, collecting some baseline information about themselves and their job and their disability, their levels of self-efficacy, organizational commitment, and other things that we're interested in measuring. And then in terms of the intervention, we would have the initial interview. We had an online job crafting workbook, which we purchased, that was already in existence. You can see Berg et al. In 2008 created this. It is trademarked, so I've noted it there. But we used that, and then we would also help them, after they work through that, develop some goals that they could set and follow for the post-intervention weeks, where they would be sent a weekly online survey, a goal accomplishment scale, and some other standardized questionnaires. So as of when we crunched these numbers for this first, about half of our participants, you can see they were fairly split in terms of age. We had significantly more females participate in our study, about 65%, about 70% were white, 60% had a bachelor's degree or more education. They were fairly split among industries. And in terms of work, most were working, at least 35 hours a week or more. We also asked that they select one or more condition that they experience, and we had a whole list as they, enrolled in the study. And it was interesting to note that nearly half had chronic pain, and they could select more than one condition. Almost a quarter had arthritis, about 12% had a vision impairment, about 12% had MS, and nearly 10% had ADD or ADHD. Obviously, as I mentioned, we were doing somewhat convenience sampling. So, for example, the MS Society webpage turned out to be a very helpful source of recruiting. So that's perhaps why we have fairly large portion of people enrolled who had MS. So once participants enrolled, we would have them work through this workbook, which was available online, to deconstruct their jobs into specific job tasks. And then they would tag each task as requiring different levels of time and energy, so high, medium, low. And then identifying the values, personal motivations associated with each task. And then evaluating the fit between those two things, so the high, medium, low energy or time versus where they would like to be focusing in terms of their values and personal motivations for each task. And once they could see that congruence or disconnect between those two things, we would help them develop goals that they could focus on for the 6 weeks of the study. We used a SMART goals framework where the goals that they said had to be specific, measurable, attainable, relevant, and time-bound. And we put those into a goal attainment scale. So this shows one example of a goal worksheet for a participant. And you can see, if you review, this shows, as expected, would be to implement a strategy 1 day a week to help organize their task at their clients' homes to be more efficient and productive. And then anything higher than that, a +1 or +2, would be, attaining that goal much better than expected. And a -1 or -2 would be, less progress than expected, or just staying at the current level where they were before they tried to implement some changes. The second example relates to establishing a self-care routine to manage chronic pain. As expected level of attainment would be to schedule and implement one self-care activity. The current level, they've identified at least that they need to do this to enhance self-care to manage chronic pain. And as I mentioned earlier, chronic pain was an issue for a large portion of our participants. One thing we did find that was interesting to us was that many of the goals had nothing to do with the person's chronic condition or disability. They're more, less related to that and more perhaps related to workplace dynamics or, working with their boss and things like that. So here's some other examples of goals that I've included here. These are all different participants. And we've tied these to different types of crafting that people would have to go through. So, thinking about a goal that related to being a leader in the workplace by connecting with people relates to, cognitive crafting as well as relational crafting. Things like increasing your upper body strength or using a new time management strategy relate to task crafting, how you could change those particular tasks of your jobs. Near the bottom, where someone states that they'll work with their supervisor to reorganize their task list, obviously is a combination of task and relational crafting. And in many cases, we did not want to have the employees get in trouble, saying, well, I did my comparison of, my key tasks that I need to accomplish and my values goals, and I don't value this task, so I don't want to do it anymore. Thinking of ways more productively to perhaps engage with their supervisor about ways to change things that were possible to be changed, understanding that some tasks are essential to a job, etc. So overall, most participants came up with about 3 goals to work on over the course of the 6 weeks. And as I mentioned, they were a mix of better time management, different ways of accomplishing tasks, perhaps to minimize pain in some cases, improve communication with colleagues or bosses, supervisors, acquiring new skills, strategies for managing stress. And these spanned, as I mentioned, the different types of crafting. Most were task-related crafting, about 1/3 were relational crafting, and 9% were cognitive crafting. And it is important to note that, you know, a lot of this was going on in our current data collection that's wrapping up soon, was all happening in the midst of COVID. So it's quite interesting to talk to people about how their jobs were changing over this time and the additional stresses that, you know, they and many of us have felt over this period, and figuring out ways to address that and maintain their employment. But overall, we found that participants were successful in achieving their goals, usually in the first 1 to 2 weeks. So on this graph, you know, anything above the 0 means that they were achieving goals at a higher rate than expected even. So anything above that 0 line is quite good, and they were able to sustain that for the 6 weeks of the project. We also found, you know, we had time to include some open-ended questions in our questionnaires to them, as well as some participated in some exit interviews, that many of the participants intended to continue using job crafting to shape their jobs. They found it, you know, very helpful, this whole process and different way of thinking about their job, and that it could be helpful as they try to move forward in their career and within their, you know, maybe even without staying in that organization, but even if they ended up working elsewhere. So in general, you know, for this project, we found not just for intervention, but some other secondary data analysis that we've run, that people with disabilities craft less than people without disabilities in general in their jobs, least in relational crafting, lower in task crafting, but more in cognitive crafting, so attaching meaning to their jobs. That people with disabilities might benefit from coaching or facilitating job crafting, especially because this coaching session serves to increase awareness about their overall job situation. As I mentioned, a lot of the goals, a lot of the participants had goals that were both disability and non-disability related. So it's important to take a holistic approach to any intervention with employees with disabilities, and not just try to focus in on that disability per se, but look at the person as a whole and their whole work environment, and think about that as the intervention is being rolled out. And we found from the feedback that we received that job crafting can help participants feel reinvigorated about their jobs by reimagining and redrawing and thinking about, you know, the implications of what they're doing and the value of it. Now, obviously, there are limitations to this study. As I mentioned, small sample size, even when we have our larger sample and analyze all that data, and it was a short duration of the intervention. So in this particular study, we have no 6-month follow-up, et cetera, to figure out if people really kept crafting their jobs and what the benefit was in terms of job retention or their career growth, et cetera. So we hope to correct for that in the future, in some future studies. But overall, we think it's a promising approach. It's very low cost. It's employee-directed intervention. Obviously, as I mentioned, we need additional research. And when we do have our full sample, we'll have additional information other than the goal attainment. We'll have information about whether or not there were changes in self-efficacy for these employees, organizational citizenship, et cetera. So we should have that information available in the fall of 2021. So here are 2 recent publications related to job crafting that have come out last year that Vijay and I had authored. But to summarize, and I'm trying to check what time it is. So we know the employment gap persists, as we saw, among people with and without disabilities. And even with people with disabilities are employed, they might be perhaps working in lower quality jobs, suggesting the need for continued research. And there are also, obviously, given the gap, need for additional research and dedication to developing evidence-based interventions that can help people with disabilities not just maintain employment, but maintain good quality jobs over the longer term. So I'd like to open it for questions at this point and remind people if they'd like to talk more specifically. I think Linda has my schedule that you can email her directly.
So thank you very much, Deborah. I think this was an excellent presentation. So we have, in fact, a number of questions in the chat. So I would like to open the discussion with Alan Heinemann. Alan, can you unmute and ask your question directly to Deborah?
Certainly. Thank you, Jose. Deborah, a wonderful presentation, as always, up to date and very knowledgeable. Given the persistent employment challenges that people with disabilities face, despite years of investment in vocational rehabilitation and various policy initiatives, I'm wondering at this point, what policy initiatives or changes you think would be necessary to improve the labor force participation of people with disabilities?
So my personal thoughts at this point in my career is that we perhaps needed more of a focus on job retention than job placement and job search. You know, a lot of the research I've conducted over last couple of decades, as well as some research recent, speaking to key stakeholders who are involved with people with disabilities. Just this past fall in 2020, Dr. Vijay Sangar and I talked to you know, an ADA coordinator, an employee assistance program coordinator, you know, HR professionals, et cetera, just a handful, about 15 people who would touch employees with disabilities, including short and long-term disability insurers. And you know, in a lot of those cases, the people we spoke to had a few common complaints. First, that, you know, by the time they learn that a person with this disability is struggling on the job, it's almost too late. The person, you know, has either kind of decided in their own mind that they want to, you know, disengage from employment, or they might be at risk of you know, being written up for performance at that point, and that it's very hard at that point to get the person re-engaged. And actually the second point they mentioned, and I'm not sure how to fix this, is not necessarily a policy thing, but a lot of these stakeholders that we spoke to talked about the challenges of interacting with clinicians to get the information they needed around employment, and the clinicians having the time, obviously, and the ability to speak with not only the stakeholder, but the employee about employment, and how, you know, perhaps their treatment could be changed to facilitate employment, or, you know, understand the functional limitations in terms of employment. So that spoke to still there being a need for, you know, additional training, I think, within the medical field in general, you know, for your like non-rehabilitation professionals. So perhaps your, you know, your family doctors, et cetera, to understand the importance of employment for people with disabilities, and that helping them maintain employment should be the primary goal.
So thank you, Alan and Deborah. So you indicated, Deborah, that education is a good predictor in terms of participation and job quality. So I think we have a question related to this. Andy, can you unmute and ask your question?
Yeah, thanks, Debra, for your presentation. Just my question was more related to education and learning a job, or converting and learning a new job. So it's piggybacking on Alan's questions, but more specifically, what kind of policy changes or improvement you would see at the educational instructional level, so that maybe this gap of employment could be closed between you know, adult or children with disability and the rest of the population?
As I mentioned, I think that's an area I'm hoping to go to next. You know, I have some proposals in the pipeline to better understand skills development, informal and formal skills development for people with and without disabilities and how those might differ. And looking at people who are in different roles within different occupations or industries, whether or not that's built in. As jobs are changing, as technology is changing, you know, how are people able to keep up with those changes and shifts, and what does that mean for the workplace? I know those are areas I'm interested in. I know those are areas the Social Security Administration is interested in as well, for example. So I would say stay tuned.
So thank you. I have a question for you, Debra. So in your different studies, you were including subjects with different disabilities, motor disabilities, cognitive disabilities, pain-related disabilities. Do you have breakdown data on how these different types of disability affect participation or job quality for these people?
I do have that. I don't have it to pull up right now, but if people would like to email me directly, I can certainly send you some follow-up information. You know, in general, in the employment literature, I know we do find, you know, quite broad variation just in terms of employment rates, you know, by disability type, where, you know, people with sensory limitations in general have employment rates that are higher than people, for example, with cognitive disabilities. But I could send more specific information if people are interested.
Okay, thank you. So do we have any other question from the audience? So if not, we are close to the end of this seminar. I would like to close this seminar. Let me remind you that Dr. Brucker is available for consultation. You can get in touch with Linda for this, and she will get you in touch with Dr. Brucker. So let me thank you, Debra, for being with us today, for the exciting presentation, for sharing with us insight on job participation and job quality in this population. Let me also thank Linda and Alan for their introductory remarks, and to all of you for joining the seminar today and for your participation. Before we close the discussion, let me remind you that we will resume our activities on next Monday, April the 12th, with Dr. Jason Carmel, who will be speaking about spinal cord associative plasticity. So with this, I would like to thank you all and close the webinar. Thank you.